I'm Christa. I'm a social psychologist, family counsellor and clinical hypnotherapist, and I also use shamanic tools, teachings, techniques, practices in my work. Shamanism is an approach which has been developed in different parts of the world over thousands and thousands and millennia of years, really, and has adapted over time. But it is, in most cultures, a kind of psycho-spiritual approach. It is used to heal the individual within the community and the community within a wider setting of spirituality. There is no better word. In a way, all shamanism works in the direction of wholeness. It sees mental health as being, or health generally speaking, as being something which is connected with the human being whole, in the classical sense of healing, of Hal, the original sense of healing. And it is that wholeness, I think, that is missing within our world and within some of the approaches we use these days in therapy. For example, cognitive behavioral, which really looks just at mind and behavior, but doesn't bring in the idea that maybe there is more to the human being, maybe purpose in life, meaning in life. Soul is something which is actually important to address, and shamanism has always done that. If you work shamanically, it's not just about approaches and techniques, it's a whole different way of actually seeing the client and in a way addressing the client, because what you do is you from a shamanic point of view, the person who sits opposite you in a consulting room is not a case. They are not an issue, they are not a condition. They are seen in a strictly shamanic way, seen as a spirit in a body, having basically being a spirit, having a physical experience, and with that the client is sacred. So that ties in with Buddhism in a way, to see the Buddha in somebody. So it is always with that kind of incredible respect for the sacredness of that person, knowing that this person who sits opposite you wants to, in a way, grow to the highest level he or she can within this life. And that brings with it a different way of approaching conditions and issues. Yes, of course, I want that client, I want to help that client to feel less anxious, of course, but I see that anxiety within the context of the bigger picture of where is that client right now, what does the anxiety tell us, where is the meaning and purpose in that client's life. With shamanism we can also use different techniques, of course, and the most widely used is journeying, the medicine wheel and ceremony, and all of those I have described in depth in the book, and I have also given case examples and step-by-step instructions how to approach such ways of working. I very strongly feel, looking at the times we are in and the development we have gone through as a species, we are now at a point where we need to understand that the human being is more than just a kind of mind and a behavior. We need to widen that scope, and within the field of psychology and therapy we should actually be at the forefront of that, but we are not. We still seem to concentrate very much on what was necessary 100 years ago, making psychology acceptable as a science. If we make it acceptable as a science, we have to cut the human being down to certain observable behaviors and thought processes. In my experience, and the experience of many colleagues, this works if we focus on symptoms only. But if we want to help people to lead a more satisfying life, achieve more of their potential, have some purpose in life, and have a wider area of connection, we need to begin to bring in approaches, techniques, ideas that facilitate this. And shamanism can do that.